right, okay. So Araba from Poon sends in our next question. Good morning to you, Araba. My teen daughter has started growing grey hair around her hairline, upper arms, and a few around her eyebrows. Could it be a deficiency? She has two questions. Let's answer this one first.
It's possible that there's a problem,
Okay.
or it's also possible that she comes from a family where they grow very early. Yes, so this child needs to be seen in hospital. Sometimes graying is a symptom of something else. The graying is not a problem, but it's a symptom of something else. Again, these are rare things, but when you go to hospital, then they ask you questions, and then they decide whether to investigate further or not. Okay. Yes, but it could be.
So the second question from Araba. My second daughter is 10 and has all of a sudden become so dull and inactive. She eats in bits and spends majority of her day sleeping, sometimes waking up around 2 p.m. in the afternoon. Could she be ill?
Yes, she could be ill. If it were only that all of a sudden she's eating in bits, I wouldn't say anything is the problem. But because the mother is saying all of a sudden she's become dull and inactive, and then she's sleeping more in the afternoon than she used to be, I'm thinking about things like low blood levels, because if you have low blood levels, if you're anemic, you are just generally so dull, you tend to feel sleepy, any small thing you do. I'm thinking about that. I'm also thinking about deficiencies in some minerals and vitamins that will also affect your appetite and make you not as active as you should be. But it's a 10-year-old girl, and these days when any child changes behavior, you should look at certain things, including abuse. So I hope it's a family setting where abuse is not likely. The mother can also have a conversation with the daughter and find out what may be the issue. Are there issues with school? Maybe her friends, she's had a falling out with some friends, or are there issues in the home? Any change in behavior that is sudden should be investigated. And for a 10-year-old girl, I would say that all the possibilities should be covered, including abuse.
All right.